Hello. Hi there. If I can just introduce my team. My name is Dr. Alok Sharma. I'm one of the naval consultants. I work in Southampton. This is Shani.
Hello.
Hello. This is Vicky. She's
One of the
one
nurse practitioners.
So at the moment, what we're going to do is we're going to take a little bit of history from you. Okay. Now,
For what reason? Sorry,
it's
sorry,
medical
I'm
history.
tired. I'm
Yeah,
tired.
I can completely understand that, but I think from my perspective,
Would you sit down?
examination of the child. Yeah.
Earlier on, sit, please.
Yes. Take my phone up. Just put it up over here.
Really want.
So examination of the child involves taking history. So what I'm going to do is basically start from mum's pregnancy onwards to what has happened so far in terms of your antenatal history, other things. After that, what we'll do is we'll examine the baby, and then after that, what I'll have to do is obviously do some tests, which we will do on the baby.
Oh, you're
And from
man.
our perspective, we'll take it from there.
Okay.
Okay.
Can I ask you please, where are my notes?
Your notes.
Yeah,
So I don't have access to your notes. at
I
all.
don't have either. I have my notes for 9 months until my labour. The person that turned up to my house 10 minutes, my baby. Born.
They usually
has
go
the
back
notes.
to live in the hospital notes. You
So-
can access them. You can get a copy of your notes.
So at the moment, what we've got is a yellow.
Should I have been with them now? Should I have them?
No. Postnatal notes, possibly, but not labour notes.
So your labour notes would be with the midwifery team.
Oh, you
What we
man.
would have is just a copy of your antenatal notes, which I've got. They are.
These bright lights. These bright lights.
So if I could just start by taking a little bit of history from you. So your pregnancy started approximately, so in terms of gestation, was he full term when he was born?
Was he?
Full term?
Full term.
Full term.
Yes.
37 completed weeks?
Full term when he born.
Yep.
On my maths?
No, well,
Based on your dates?
you were 38 weeks.
Yeah, on my maths he's 38.
Okay, and when did he deliver? On what date?
When did he deliver? On the 1st of February, 3:55.
In the afternoon.
No, AM.
AM.
Okay.
Sorry, you said you have my notes.
I do have your notes, yes.
So why are you asking me 3:55
Because I have to
p.m.?
go through these things.
So you're asking my psychological
Yolanda,
state, is that?
Yolanda,
It's okay,
Yolanda,
we're just going to answer
Yolanda's
his
getting
questions.
some backstory.
I think
Okay.
it's really important at this particular stage that
Yes.
there are certain things, certain questions we have to ask to make sure we're getting all the right things.
Okay, so please talk slowly because if you are checking me and testing me, speak slowly please, even because my baby is crying and I want to make sure that I will pass in the test.
I'm not testing
Oh
you.
yes, it will.
Okay, so
Yeah.
do you have any issues with, have your membranes ruptured early? So did they rupture before delivery of the baby?
My maybe
No, I was present at the birth
Yeah.
at around probably 9 centimeters,
I
but
was
we didn't
on
do
the
any
water.
vaginal exams.
I was on water when very near when he born.
Okay, and are you known to carry droopy streptococcus? Are you a carrier
I'm aware.
of droopy streptococcus? I'm trying to make sure that the baby has no risk factors for infection.
Group B, were you tested positive for Group B strep?
Did you have any swabs or anything done during pregnancy?
I don't know what we're talking about.
Okay, did you have any swabs during pregnancy, or were your waters, were they tested?
Urine has been all the time that I was going to my midwife. I would give the bottle to the midwife, and many times I had to say, should I take a bottle for next time?
So at any point did your midwife come back and say to you you've got a urine or water infection?
Sorry?
At any point did your midwife come back and say to you that you have a water infection?
Water infection.
Any infection? Did
Infection
she
of
say
the
you had
urine.
any infections? Any at all?
Once she said there is a stick in here and yeah, there is an infection.
In your urine?
She gave the opinion that there was an infection.
Yeah, she didn't say it is an infection. There is. Maybe
From a
infection.
dipstick, it's impossible to tell if there's
Yeah.
an infection.
You can't, yeah.
They
She's
can
got,
sign it.
Yeah.
But an opinion was given. Do you know when this was?
Late.
can
Very
you tell
late.
me what the relevance is, please?
Yeah.
Because if mum has a urine infection or an infection
If she
with a
has
rupture of
or if she
membranes,
has.
Yeah.
there's a risk the baby can get infection through that process.
Okay.
I think common process is that we ask for all these risk factors. It's a very common question. Your midwife will be able to tell you. We commonly ask these questions.
Yeah, they just want to make sure that you didn't have any infections during pregnancy. If the midwife was concerned, if she thought there was a marker for infection, she probably would have asked you to do a sample of urine to send to the lab to test. You know, she did
The
that.
urine has been done throughout the
Yeah.
pregnancy.
But they never told you you had an infection.
They never told me I have an infection. Never.
Okay.
Never.
And you haven't had any fevers prior to delivery of the baby?
Never.
Okay. So today we have some information that's been passed on to us to say that Dad contacted the GP to say he
Sorry,
felt.
I can't hear.
Do you need to feed him again? Is he hungry?
Yeah, I do. I'm
Possible
feeling.
to talk while he's...
Yeah. Are you breastfeeding him or bottle feeding him?
Breastfeeding.
You're breastfeeding him at this particular point. Okay. Can I speak to you while Mom breastfeeds him? You could give me history.
I can hear and I can talk. Yes.
Are we going to go that way?
And then on this one, should we do this one?
Hello, man. Hello, man. Hello, man.
I was just wondering if we could get some chairs.
Yeah.
That way we could also say.
Oh my god, look at
Just
this.
maybe just turn on that light and turn this one off or something.
So then you turn on all the lights. If you want, we can do that when we examine babies. Just to sometimes bright lights. How the baby feels.
Oh, little man.
I'm sorry, I always breastfeed in my brain. So it's can you the back, please?
Yes. There you go. Oh. Understand, it's probably a bit stressed, isn't it?
He is stressed. Again, that brings me to the point that I need to examine him. So what I was going to suggest is it possible for me to have a meeting once he's breastfed? Because at the moment he looks quite irritated.
Okay, now I think we have a safe environment.
Noisy chairs, doors opening, bright
I was
lights.
just waiting.
You know, it's
I
encouraging
was
it.
just
We did the lights on this side and
There's no
brighten the
chairs
ones over
over
there.
there.
That's what we're wondering.
Yeah, thanks for giving me 1 second. It might get a bit dark for a second.
That's fine.
No pressure, Mom, to breastfeed. You have 1, 2, 3, 4, 5 persons.
Alright, that's alright.
5 people.
That's, yes. Oh, yes, that's better. Thank you.
5 people.
Hello, man.
I was going to say, if there are 5 people in the room, we could keep the midwife. Do you need to be here?
Oh,
I
yeah.
think so.
Who are you?
I'm the doula. I was there for the birth.
Yeah.
She's been here
Father?
since the beginning.
Okay.
Father,
Okay.
friend,
An important.
friend. But father is father, right?
I'm not doubting that. I'm not doubting that.
You 3
Yeah.
is a midwife. She's here with me. So you 3, I don't have a clue who you are. I don't have a clue who's paying you.
Yolanda. Yeah. They work for the NHS.
And so, could you reintroduce your assistants here?
So I've already introduced us more than once. Once when you came in through the doors. I've introduced us when we came in again. I'll do that again. Can I just ask, are you recording on your phone?
Oh, yes, I am.
Okay. That's not allowed in the hospital.
It's not allowed in the hospital.
No. I'm really sorry. I'm going to have to ask you to be removed for doing that. Could you please hold security?
So I can't just turn off my phone?
You
Security to
cannot
switch off the
record.
phone?
You're not allowed to record conversations. This is a
So
medical
sorry,
conversation.
security to switch your phone?
No, I'm asking security to get that person removed for having recorded this
She
conversation.
can switch off the phone right now.
Yeah, to
Is
switch
there
off.
any
But it's
security
illegal.
in
It's
the phone?
illegal for her to record. And I've just seen you trying to record a conversation that we're having between a patient and a doctor. That's not legal. I have
Okay, can you not just say it's not legal, so then
You
switch
don't have to.
off, please?
no, if she was doing that, she should have said
But I
that.
didn't know it wasn't.
You didn't know. She's a
So
midwife.
she's not allowed to record conversations.
Why?
I'm really sorry. I'm going to have to ask her to
Okay, so can you remove what you have done regarding the security.
No, I'm going to ask security to come in because I'm really worried about the recording standards.
What is the concern here? I've stopped the recording.
There's a violation of conflict. No, I'm really sorry. I would like to
You've really changed this. You've really, come on.
I haven't changed
You're
this.
for
I'm
a
just
baby.
concerned. I've just seen you recording me.
You are concerned.
So
You're not concerned
why
about
are
my
you
baby.
concerned?
Because that's not legal. You're not
All
allowed to
right,
record
so
conversations
inform
between
them,
people.
please.
Okay,
and we will
just
proceed
please
with
calm
that.
the situation down. Please.
No, I'm really
Please.
sorry.
Why are you doing this?
Because this is not right.
You
should have
didn't
said-
say it. We don't know. So we didn't
She's
know.
lost 2 litres of blood.
I'm
Come
sure,
on.
I'm sure, but
And-
it's not right
And
that
English
you are
isn't her
recording the
first
conversation.
language, so
at
it's
the
just for
moment,
clarity.
it's not for clarity. I'm really sorry you can't do that. I'm gonna please
Well,
ask
she
you to
didn't know
leave.
she could
Can
be.
you please leave?
Could we see the policy and the manual? I
So
don't
there's
really.
no policy in my
Alright,
mind.
okay,
Don't
so-
go into it. Come
Guys,
on, allow this.
security. How many people do we need security to switch off a phone off?
It's not a matter of switching the phone off. At the moment, this is my patient. Okay, these are the patient's friends. That's the independent midwife.
I am not a friend. I'm a father.
I'm afraid I don't want that person next to me because she's been recording us.
Sorry, you don't want her in a room?
You don't want her in
You don't want her in the room?
I don't
Why?
know, so she's been recording us without telling us. That's not legal.
She has refused to leave the
Can you confirm that's illegal? Under what law, please?
We have not been
You're being
told.
used
The
as a
fact that she's recording on private property without
private property.
property, the hospital is private property.
So we have been informed.
Property.
The hospital.
So you've brought us into private property. Is that what you're saying? You forced us into private property. This comes under, this is not right.
I don't think you'll have any choice.
Yeah, that's fine. That's all right. I'll stay out there.
I don't want you to leave.
I know, but we can't help it. It's all right. I'm just gonna try to stay.
I don't want you to
I'll just
leave.
try to stay in the hospital. I'll wait for you out there, so I don't bother the Dr. Sharma.
I don't
So
want
he
you
can
to
do
leave.
his.
I don't want her to leave.
I'm really sorry. I'm really sorry.
She was on my birth.
I'm really
She
sorry.
is my
I'm not
testimony
gonna-
of my
I'm not
birth.
going to be able to examine the baby.
You're in good hands.
Because
No, I'm
she's
not.
been
You're in good
recording.
hands.
But you
You
can
have
tell.
a really good
I'm really
midwife
sorry.
here.
So what is it? What is it on the recording?
I'm really sorry.
Wow.
And I am going to actually speak to the police about the fact that this recording is getting done. I'll get on to do that.
So, can you say what are the other rules?
Okay.
Can you say what are the other rules?
So you can't record conversations like this without telling another person.
Okay, alright, please. Alright, please.
I'm
So
really
can you go out, please? Can you go out? I'm like this. There is another more people coming here. Can I get myself?
I'm going to get the police.
Alright, we're not
I'm
going
going to get the
anywhere.
police to come in.
Alright, okay. Can you please just go out?
Please, come on, you're trying to create.
Just go out, please. Just go out.
Please, please.
I'm
Where's your humanity?
running.
Where's your spirit? Wow.
Okay. Look, close the door, please. We go to there, close the door.
It's all right. It's closing. It's closing.
Stop, no, stay there, stay
I
there.
asked them if they won't come in.
Stay there, please. Hold the door.
I've asked them to call the
Hold.
supervisor of midwives.
Hold. Hold about that. Hold about that.
Okay, don't.
Don't worry about it. Just sit on it.
Are you sure?
Yeah.
Yes.
Are you sure?
Just if they ask you, you have to lie then.
There's nothing that we can do about it, I don't think. I'm really sorry if there was anything I could do. I don't think there is.
Yes.
So I think
Are you sure about this?
I think we have to comply
Apply.
with
They are forcing it by
and
security.
the more at this
We don't want to
stage,
create any more.
So then, are you
It's-
sure about this?
it's already gone so far, the breakdown in communication, that if you don't, however you don't
I know.
comply,
but
whatever
do
you
know
don't
what
do
you
now,
do you know what you do?
Leave it.
It's
Okay.
okay.
Leave
I
it.
know,
Please.
it's not.
Don't even.
Alright, okay.
I think, I mean, I don't want to turn into one of the bad guys, but honestly, the best chance of kind of
Of getting out of here
getting out of
is
here
to just now
at whatever
comply.
stage is to
Yeah.
comply
Okay.
with everything they say and cooperate with everything they say. We don't. It's like being in jail. We don't have any choice.
Yeah, I'm in
Because
jail.
the police and everything are here.
Yeah,
So
I'm in jail. And the only person that
Leander.
they didn't say that.
Yes.
It's okay. I'm gonna try and stay in the hospital. I mean, I don't have to leave the hospital,
Oh my
but
God. They didn't
So I'll
say
leave
that.
it
It's my
here.
support.
we can ask to to wait until the supervisor of midwives gets here, because I've asked them to call her and I've asked them to have her come in. She's supposed to be an advocate for you. You need somebody here to, I mean, I can try, but I don't work here. She works here, and it's her job to support you. If she doesn't, we can bring her boss to come in. Bring her the supervisor of midwives.
So,
Just
I
relax.
know, I've asked-
People's helping. People are helping.
So we can ask. I don't know if they'll do it, but we can ask to wait, because you need an advocate from the inside as well as me. If I'll do whatever I can.
Yeah. Absolutely.
okay, I don't want to answer any more questions.
Don't, Yolanda.
I can't answer.
You have to
Yolanda.
reply.
Let your husband partner answer.
Yeah. What's up?
He's
Then-
really innocent,
and you
he doesn't know what he's saying.
I do. Yolanda, don't say things like that.
You're
Please.
very innocent.
Yolanda.
You don't know when people they are.
Don't give them this.
It's
They are
okay.
just controlling. I know he was checking my mind.
Don't. I know.
He's just checking my mind.
Yes.
If
He's
I-
assessing you.
If I know if my baby born at 3:55 a.m. or
No,
p.m.
I think he's just taking a history. That's
He
really
was
common.
taking history.
But
He's just
I
taking
understand why everything feels like they're going out to get you, because it is a bit like that. It feels a bit like that. But I think the best bet is to cooperate as much as you can and as
Yes.
calmly as you
I
can,
think
even
the
if you're
best is
even if
saying,
you're
I don't know, I don't
completely.
remember.
No.
I don't know. I don't
Just
remember.
cooperate. Just cooperate.
They just want to get something.
Just
But
let him do
for
what-
your son and keeping your son with you, you just have to play the game.
Yes.
Be an
Just
be an actress.
be a
play the game,
perfect parent now. We're gonna switch it on
and comply with
and
everything.
just be happy that they're helping you. Imagine that they're helping you. Okay.
Yes.
They're helping you get out of there.
Yes.
Okay.
Yes.
Okay, well, I've got your number and we'll keep in touch.
Yes.
and-
Yes. Yes. Yes.
Thank you.
Can you sit here?
Have you ever seen this?
No. I mean, so I didn't know it was illegal to use your phone to record. I think a lot of people do that for clarity, to be able to remember what a doctor says. Like, he's not English as a first language, you're not English as a first language. I'm from another country as well, and it's just, you've lost a lot of blood, and it's normal to want to record is just to kind of help. But he's paranoid because for whatever reason. But I think now it's right or wrongly, obviously very wrongly, gone to the stage of social services, and they don't need your permission to do
What they want.
what they want to do. So the quickest way to kind of is to play the game, is to try to be
Just
moral.
Yolanda,
parents,
don't be
and
confrontational.
No,
it
Don't
just-
no more.
it
Just
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 won't-
don't be
it won't
confrontational.
help,
It
I'm
make
afraid.
he's definitely from one side. He's one-sided.
yes. Whatever.
I'm not in
Whatever.
confrontation.
Don't be confrontational. We have to. We just have to. Look what they. We just. Hey little man. Hey little man.
I'm not in confrontation.
It's more about him.
I won't.
Just relax.
Go ahead, tell me.
Just look at me. Just look at me. Don't worry. Oh, look, he's looking for them. Put his hand there looking for them.
He's a good feeder, isn't he?
Yes.
Come in. Thank you.
Hi.
Were you able to get in touch with the supervisor?
Jenny, who is our DNS coordinator, is on. She can speak to. I think they have a number that they can phone, but it would be her home phone, so she just wants to ask what questions we do.
Well, they'd like the support of a supervisor and advice to come in. Thank you.
The mouse.
I've never been in a police. I've never been in a police. Anyway.
Hey, little man.
Charlie.
Kathryn, don't worry. Don't worry.
Sorry.
Look at little man. It's a little man.
Have you taken home?
That's it.
Fine.
Have you got some water, Kathryn?
I've got, yeah, thank you. I'm just going to ring the supervisor myself. I think I've got
Little man.
For here now. Yeah.
Hello, little man.
Okay, thank you very much. Bye. Okay, she said she'll be here in 10 minutes. The supervisor of midwives, it's her job to advocate for you and support you. She works for the hospital, she is NHS. And in her supervisor's role, it's meant to be separate from the NHS, so it's meant to be not as an employee, she's meant to be a supervisor of midwives. Yeah, it's a statutory position and it's meant to be supporting women and the safety of moms and babies.
Yeah, thank you.
So,
And if for some reason that she isn't doing the job that you want her to do or supporting you well enough, you can ask her to ring her supervisor, who's called LSA, and she's over the whole
Do you know her?
south of England. Jenny Hughes, yeah.
The lady's
This
coming
one I
there.
don't know. No, her boss I do know. I know of. She has a very good reputation.
his
So you
mouth
can,
is dry.
I'm just going to write down what I have.
I need some wet one.
A wet one, yeah.
I don't
Cold.
No, just give me wet, please. Oh, darling.
Oh, little man.
Oh, darling.
Oh, little man.
No.
Oh, little man. Oh, little man. Hey?
Sorry, baby.
Oh, little man. He's dying. Here we go.
Come on, let's go. That's all they come. Baby. Come on, baby.
Hello, little man. Oh, little man. Right.
That's better.
Exhausted, I'm sorry.
Yeah, no, you must be shattered.
Oh, little man. Little man. Oh. He likes my warm hand.
He does.
Oh, little man. Oh, little man. Lillian's okay. Send him out into the no more shit. Sorry.
You want her if they're doing
No,
on her?
lift. She's outside, isn't she? She
Does she have a car here? Did she drive? Or how did you get here?
came in the police car.
So she doesn't have a car.
No.
Oh, I should have given her my keys. She could have sat in my car. Hi, are you okay? I didn't realise you were kind of out there outside. Are you? We're still here. They haven't come back in yet. But the supervisor, she's in the hospital. The supervisor of midwife is on her way in, and she'll be here in 10 minutes. So I just want to make sure you weren't out in the cold, because I could give you my coffee and you can sit in my car. Okay. Oh, good. Okay, good. As long as you're warm, we'll keep you posted. Okay, thanks.
Thank you, Lee.
Bye. She's just gone up a couple of floors and there's someplace she can wait there.
She was right in her car.
Here, a couple of floors up. She said that one of them told her to go across the street. There was a cafe, but then she asked the porter who said there's a place that she could wait somewhere. She's inside in one. It wouldn't be out in the cold. When you phoned the GP to ask them to come out and just do a regular check, did you actually speak to the GP themselves, or
No, I
was it
spoke to the
just the
receptionist.
receptionist? So, because I think all of this is based on that.
Yeah.
It's
I
not
never-
true because they said they set up the stuff from 1 o'clock with the
No, the whole.
service. And
They step it up and they increase.
Escalated, but it was from them. The only way they can act or really do anything is if they think the baby's in danger.
Yeah, but they thought the baby's been images since I left the hospital because they were knocking since then. They haven't stopped.
Yeah,
I
but,
said that the
that's kind of normal. They just wanted to check you up, or that would happen anywhere. Anybody
we
going
can
home,
go out there.
that would happen.
The doctor.
They can't, and you can decline that, but I think there was miscommunication between declining or not declining, and I think it's halfway reasonable.
This has been lost from. This is lost.
Yeah, yeah, to the stage that
From
it's
the beginning,
gotten.
from the time that person that turned up saying that she needs to go to her husband and the child, and she's gone worried with the chicken.
Come on, Linda.
Hello, I'm Ginny. I'm coordinating this evening.
Hi, Jenny.
Hello.
Lisa's on her way in. She said she'd be here in 10 minutes, and that was about 5 minutes ago.
Who's Lisa?
The supervisor of midwife on call.
I thought we are expecting somebody to come from Labour Ward actually to have a chat with you. But you've called.
I've called, yeah.
Okay, that's absolutely fine. Absolutely fine.
Now, I have a humble request. Hear me out for 2 minutes. Okay, just 2 minutes. My name is Alok, so I'm introducing myself again. I'm the consultant neonatologist working on the unit. This is Jeannie. She is my senior sister. She's the nurse in charge on the unit. This is Vicky. She is one of my senior nurse practitioners, very experienced. At this particular point, the reason we have asked you to come here is because we have had concerns expressed to us about your baby being unwell because you contacted your GP. So far, we have no record that your baby has been seen by any medical professional. I have nothing in writing to see that, both by going through your notes and from the notes that we currently have. What I urgently need to do, and I humbly request you to let me do that, is let me please have a look at him at this particular point. Is that all right?
Can I say something?
Please.
I left the hospital. I set up with my midwife an appointment. That appointment is on the 12th of February. I don't understand what is all this about. The first person turned on my door. I was not expecting that person. I am with 2 boobs exposed at home. I have not been told that someone is going to my house just turning up like this. I'm not expecting, I'm literally naked. I just left the hospital. I feel I'm being abused, being just knocked because they want to save the baby and without saying anything. I feel just abused. I felt abused. I just want to rest. I just want to rest. That person, please, that person, my partner, answered the door and said to that person, sorry, we don't know who you are, and you just turn up with no time, and we are through the intercom switched off.
The intercom switched off.
So the conversation doesn't finish. So we don't really say to her, please come with time, set up a time. That's all we are about. That's all that we are about.
Whenever we have appointments, we make appointments. That's how we all have that. That's how we live. We make appointments.
We didn't go out running at the person and, hey, we haven't finished the conversation. And the person didn't ring the bell again. That's it. The second time, a few hours, 2 hours, I think. That happens again. In the same way, is my midwife. We said the same. We were tired. We were tired. That just happened 2 hours before. We were tired. And he
I
said
said to her, respect her. I respect my girlfriend's wishes, my partner's wishes. I respect that. She wanted to rest. She lost 2 litres of blood. She was on the floor, nearly dead.
After recovery, I didn't rest in the hospital.
The
The lights were on. The blood pressure was measured. This was measured. That was measured. The urine. I had to go and do more urine. This and that. I had a thing. Stick it in here all the time. I didn't rest. I just wanted to rest. Second time is my midwife. I know my midwife. But I'm so tired that even my midwife, I don't want to say it. I'm tired, I'm exhausted, I want my space. I have my baby, I have to breastfeed, and I don't know how to breastfeed. I have to learn how to breastfeed, and his baby needs to learn how to breastfeed, and there is someone knocking on the door. It's the second time I am like this. That's all about. I speak with my midwife on the day after. On that day, she texts him, he texts her. She says that she believes that he is upset. And on the day after, she calls. I wake up for the first time. I did wake up for the first time. I did manage to sleep something. So I think this is the third day. Third or the fourth, I'm not sure. So they were talking, my partner was talking on the kitchen over the phone with her, with my midwife with me. I woke up because he's starting to get nervous. And I over the phone I said, Donna, I will tell you what is this about. Because she doesn't know. She's like, your partner didn't allow me to come in tomorrow and I came here. I think he's upset with me. I spoke on the phone with her and I told her, I didn't rest. The labour was quick. The midwife turned up, said that she needs to go back to her husband, and she has a 4-year-old girl. I don't know who is this person. I don't know if she has a girl or a boy. I can tell you this. You can go and check if it's a girl or a boy.
Can I?
Sorry.
Because they won't have time to listen to the whole
no,
story. And I know you just
I
need
set
to
up.
time
I'm
it.
sorry. I set up over the phone with my midwife. She understood. She apologized for having turned up on the previous day without saying anything, and she said that I should not expect that you would be happy to see me.
An appointment's arranged for the 12th,
Yeah.
which is next
I
Friday.
asked her when
and that
are
was
you.
all arranged.
Yeah.
So whatever's going on here.
So sorry. I asked her when are you available. She said, I'm not available tomorrow because we were to go on the day after. So I was going, if she wanted, I was going to go. Like, so I'm sorry. So
It's late.
I know. So I told her I haven't slept since the 31st, so I just want to rest. And she said yes, and I asked her, so let's do the appointment then. We are going to see you. When are you free? She said, not tomorrow because, now I'm confusing. Not tomorrow because,
I've told them.
just wait, not tomorrow because, no, not tomorrow because I'm full booked. And I was okay, so when? I only have seen you Thursdays and Fridays. So today is Friday, yesterday was Thursday, so it could be yesterday and it could be today. But because she said she was full booked, she did it for next week. Next week.
She was fully booked this week.
It's on my diary, 12th of February,
So
10:30.
you didn't mean to decline seeing anybody, it was just that you wanted some continuity.
And after that, I'm sorry.
I need to stop you there. The reason I need to stop you
Even
there
with
is
that appointment, the people that carry on knocking on doors,
I can,
even a policeman.
my staff can understand that. Now, at this particular point, we are in a situation where I want to help you. Please try and understand that.
Please.
I want to help you. Now, the only way that I can do that is I want to keep you and baby together.
Please.
Okay? I don't want to separate you, but I need to have a look at the baby,
Yes.
please.
Yolanda.
Who turn the lights on?
Yeah.
Hey, young man. Hello.
He has a dirty nappy on this side.
It's going to be bright under here, okay? Did you bring any nappies with you? Or did you just have a nappy?
Sorry?
We've got a nappy.
You've got
We've got a
nappies.
nappy. You've got a nappy.
I'll just go get some nappies. Oh, some down
We
here.
have
Sorry,
got a
Alok.
nappy as well. Hello, man. Hello, man. Hello, man. Hello, man. Handsome boy. Look at your man breast.
So Alok's going to do everything with Dr. Tola, but I'll also do some nursing obs, so I'll just check a temperature. And I'll put a little sticky dot on the hand that measures the heart rate, and it'll come up on that monitor.
Sorry, say again.
I'm going to check his temperature, and then put a little sticky dot on his hand that will measure his heart rate. Okay?
It's not okay, I feel abused.
Okay, Yolanda.
It's not okay, I feel abused.
Yes, it's a nothing.
I'm really sorry.
My baby.
I'm really sorry.
My baby.
I'm sorry.
I feel abused.
It's okay.
I'm going to
It's
look after him
okay.
just like I would look after my own child. I promise you that. I'm going to look after him just like I would look after my own baby. Okay? I'm not going to give him less than that care. I promise you that. I promise you that. I will never, I'm not going to hurt him. I'm going to look after him just like I would look after my own child. My baby, okay? Okay?
I didn't know what was mother's love until now.
It's okay. It's okay.
Can I take him from you? Just for a second.
Thank you. You can see what Alok's doing.
You got on first name yet?
We haven't given him the name.
Not on first name. Okay. Just take him off.
There we go.
Babe, come on. Come on, babe. Oh. Oh. You got food?
Well done. Start over first. We did that on purpose. Yeah, that's good. That's good.
Oh. Man.
Bring that all one by one.
Man.
Blimey, you just get up there with that, mate.
What's that for?
You can get anything out of there.
just testing the pulses, just, yeah. Oh, that's good. So, do you have another napkin? You do have that. You do much better. So what I'm going to do is I'm just going to tell you what my findings are, just so that you can reach in the loop. So at the moment, the good thing from my perspective is he's big, he's well perfused, he's got a good root and suck. His left eye has got what looks like a little bit of conjunctivitis, maybe pus there. Maybe what, sorry?
There might be a little bit of pus there. It's quite yellow. Yeah.
Yeah.
The fact that it's one eye, not both eyes, it's unlikely that this is just gland blockage. So gland blockage means that when babies cry, these glands are often blocked, and by the time they're 3 months old, they open up. Now sometimes
very small one.
Yeah. Sometimes when babies have discharge in their eyes, it's clear. But in his case, what you can see is it's clearly quite yellow, very sticky, and it's crusting. So my worry.
We've been in the taxi.
It just
There's
got
been a lot
worse.
of stuff
It's
going
just
on.
got worse.
It's nothing that you've done.
That's what we're seeing.
It's just what we're saying. So
And then it tells us clearly online. Okay.
it's just to reassure you.
Yeah.
Okay. The other thing, obviously, from my perspective, he's got a good suck, as you can see. So he's active. He's got good reflexes. He's alert. He can open his eyes. My biggest worry at the moment is he's very jaundiced.
Jaundice, yeah, it came on 3 days after. That's natural. I've done my own searching on this.
Not done
They can do a test.
That's right. I think what we need to do is test it. So normally what we say is, when you look from head to toe, if jaundice is reaching the shins, you can clearly see that jaundice is on the legs. It's not reaching the soles at the moment. So I worry about that level. And I think from our perspective, the sensible thing to do at this particular point would be to do tests, to look at the jaundice levels. They will need to go to the lab. At the same time, it's best because that eye is infected to do what is called a CRP. Because if that's very high,
Can you say what that is?
it's a marker which tells me whether there might be infection in his blood or not.
Okay, so how would you get that?
We just take a blood sample from
Blood sample.
So with the blood sample, I think it will be sensible that we check a gas and a blood sugar. That's routine. So I would do that for every baby. It's not because I'm worried about him. So any baby who comes here with this history, I would do a blood gas on. We can all do it with one prick. Happy to do that. Send the bloods. The bloods will take a few hours to come back. There is potential in this particular situation that if the jaundice levels are high and they meet a cutoff level, we might have to start them on special lights. Because if the jaundice level is high, it's not good for babies hearing. It can be detrimental. Okay. So at this particular point of time, he's obviously hungry. We want to help you with breastfeeding. Now,
You need to help me. I'm giving
I think it's more just to be there for support. Now, under these circumstances, clinically, there's no doubt in my mind we'll have to admit him to the neonatal unit. And then we've done these tests.
So the test?
So the tests for the jaundice, all of these things, because they will take a few hours. He needs observations.
Okay.
So that means a pregnant midwife.
Sorry?
That means separating him from me.
I'm going to try not to do that. Have a seat, and we can give the baby back to mommy.
Do you have a belly manometer here?
We don't use transcutaneouses because they upgrade by about 50. So we
I know
studied
some
them
hospitals
extensively.
do, some don't.
So what we do is, it goes to the lab, we've got an optical bilirubin, it will give us a result. It takes about 2.5 hours for us to get that result back.
I work at Manchester and they use them there, but I know.
Oops, sorry. Yeah. Oh, little man. It might be a little bit hot, so just stand with your little cup.
So the reason
Let's do that.
to do something is because
Do you want to breastfeed him first?
he's yellow.
He's yellow.
Yeah.
I think from our perspective, the key thing is making sure that he's not in a range where this jaundice level is going to be
He's
dangerous.
not really
That's
yellow,
what
is
the
it?
blue light's for, isn't it? Yeah.
We obviously we have separate lights which we can use for him because he'll be admitted to a different area. Now, my plan at this particular point of time is to try and keep mom and baby together.
Please.
Now, for the baby to have lights, we will be providing them in a room which is called room 1. But I'm also conscious that we want you to be able to see baby, stay with baby.
I'm sorry, I already.
Want to feed him?
I just because I can't hear anything now. I finished
feed
the
him.
Okay, anyway.
Just feed him.
Can you guys finish on the
Let's just swab first. I'm taking a little swab. Is that alright?
Shall we pop him here?
Yeah.
We'll keep him calm. We'll keep your baby calm. You can listen to Alok.
Sorry, my head's
Let's clean your eye.
So,
So can you say what you said?
yeah, so basically what we would need to do is do those blood tests. From our perspective, once those tests are done, it takes hours, 2 hours for them to come back. In the interim, obviously, we'd like you to be there to be able to feed baby. Now, we have rooms, side rooms, where we can accommodate you so that you can sleep and you can come and feed the baby at your ease. Okay?
So it's talking about separation.
So, physically, I can't keep you in room 1. But you could stay there, you're free to visit, with 24/7 access.
I don't need to rest now. If I have not been allowed to rest for 6 days, now guys, don't be concerned regarding my rest.
Yolanda. So
So basically, they do the hospital test for the jaundice, and if he meets the lights and things, then they can provide all of that care here. They're not sending you away from him anywhere. You can stay here.
No, but I can't stay whenever the test.
No,
That's
you
why
have
I'm
20
saying we
minutes.
need to another room.
You have 24-hour. You can stay 24 hours with him.
Just next door.
Just
next door.
But you can visit 24 hours. Is that right?
So-
Am I misunderstanding?
This is where we're going to keep him, where you came in from. There's a room at the side. Mum walks in and out of that. It's as close as I can get for her.
But there's no limit to how much time.
24/7.
Yeah, so you
Both
can
of
stay.
you
You can stay with him
24/7.
as much as you want. But if he's asleep and you need some sleep, then sometimes you would probably go and sleep. Would be sensible because he needs you to rest
I
so
need
you
you to
can
rest so you
make
know
your milk and all of
That's
that.
really important. That's what he wants. It will help. And I would ask you to trust me. Okay?
That's all I want to hear.
Okay, just trust me.
That's all I want to hear. I don't need to hear what test they need to guys do. You should tell me that. I'll just trust you.
Oh, I know. Can I good clean?
Can I tell you what you do for what your profession is? He's a cardiac physiologist.
I'm a respiratory physiologist.
I'm sorry.
I have grown up in hospital.
There we go.
And you're going through an incredibly difficult period. And I don't want to patronize you at all. I want to help you.
Oh, you man. Oh, you man.
It's hard. I'm sorry that you're having to go through this. I'm sorry you're having to go through this. Help us help you. That's the most important thing. That is the most important thing.
Are you going to be here all the time?
To a certain time.
To a certain time. I have colleagues who are better than me. These people do all the
No
hard
one is
work.
better than you if you have that.
Trust
No
me,
one
you
is
say.
better than you if you have that. You know what I'm saying?
I know.
the nurses who look after the babies. So let's do those bloods. What I just need to say is, have you had something to eat? Have you had something to eat?
Not for little, we were eating and
We were eating at 2 o'clock, and the policeman turned up, and we didn't eat. We didn't eat. What's the time?
put ourselves after you.
Okay, can we make some toast for you?
Oh,
Yes,
in the
please,
living house, they asked for some pizza. We put it in the mouth. I saw phone number 0845 was the point, so we stopped. We
didn't finish.
We haven't eaten.
So we have some toast. Yeah, thank you.
We haven't eaten.
Look.
Would you like a cup of tea?
Hey, baby.
Ethel? Are you happy to off screen?
Yeah,
Thank you.
Into the don't start it.
I'm anemic now. I'm anemic now, they started.
Oh,
Which one to do on there?
oh, baby.
Okay.
Oh, baby.
Yeah.
Oh, baby.
Right, let's get you all sorted out with some food
Toast.
and hydration.
Yeah, thank you.
You were saying which test they need to.
Yeah.
I can
For the jaundice,
explain
for the
more of them to you once we go into the nursery one.
We're going into room 1.
Yeah, but we'll get you
Going
some
to room
toast and
one.
stuff
And what's
there.
our special care nursery? It's our lowest level, and it's lovely down there. You'll see lots of babies, and mums just feel like you feel. We're here to help you. We are here to help you.
I just asked to rest.
I
I've
know.
been trapped in alcoholism and abuse and abuse and abuse. I'm
It's
scared.
fine. You've got a beautiful
I
baby.
know, I'm scared.
You know what have you got to be scared of?
Policeman.
Yolanda.
Policeman.
Yolanda. Yolanda. Come back here. You have. Yolanda. Yolanda.
I know. I know.
Can I see him, please?
I think you might want some more milk.
Yeah, you feed him. Just feed him back.
Of course you can. It's your baby.
Is it?
I think we're just going to take it out.
It's my baby. I don't like it's my baby. It doesn't
Yolanda.
look like it's my baby.
Yolanda.
It doesn't look.
Yolanda.
I know it's my baby.
Yolanda.
She means because of everybody's interfering.
The way they have been treating me.
No, come and sit down. Come on, let's.
I know it's mine.
Your beautiful baby. He looks just like his dad, anyway.
I don't know.
He does.
It's a bit of.
You know, guys, you analyse and think you are concerned with yourself, I'll be concerned with something. You know what?
His toes are a bit funny, aren't they?
Oh, no, they're all like that.
They look like
That's
oh,
why
is
it's squash.
We should be concerned with this. That's all I'm saying.
Those look like mine, those look like mummy's.
Oh,
That's where we're concerned.
they're lovely. Look, they're wiggling. That's the main thing.
Oh, little man.
It's fine.
Oh, look, yes.
Yeah.
Yeah, little. Mm.
It's hard. It's lots of things happening all at once, and
yeah.
your world's been turned upside down in a matter of hours. We understand that.
So do I.
You're
survived.
doing a fantastic
And I lost
job.
2 litres of blood.
I know. That's really
That
rough.
would make anybody
I feel
Yes.
like on the house I was at home.
What a beautiful baby. We're gonna make.
I didn't even time to know what happened.
Jaundice is very, very
It's very common, yeah.
Yeah, honestly,
It's just-
when you walk down the unit, you'll see loads of phototherapy nights.
Mm.
In fact, we run out of them sometimes.
That's the blue lights. You know these
yeah,
sort of things, blue lights.
yeah.
Hey, little man. Hey, little.
You'll,
The big yawn. Big yawn.
hopefully, when we have a room nearby, we'll be
Big
able
yawn.
to you get some sleep because you're never used to that you're a young man if you're tired. You know that.
Yes.
Yes. Such a nice day.
My nose.
Oh.
You seem to be a shortage of tissues. I think it's paper towels, I'm afraid.
But, does it work? Oh,
There you are. Your milk's coming in nicely.
oh yeah.
Oh, no, not that one.
Sorry.
Oh, really? Really?
Automatic, that is.
Lovely. Excellent.
Yeah. At the same time. This one's a bit nicer, I think that one's a bit dry, so.
Is that milk?
It is.
Yeah.
I have noticed like it's like that.
Comes out when the other one.
Yeah. I didn't know it was milk. No. I didn't know that.
He's been awake a long time.
He's looking well.
Mm.
Long time. We're in Ian's house.
Do you have
social
have you got breast pads?
No.
You haven't.
I didn't have time to buy them.
Don't worry. Don't worry. Don't worry.
Social service employees. People they are talking about.
Linda.
This is the only one like.
I think there's been a lot of miscommunications, and hopefully we can get everything sorted out. Now you're here, and baby can get good care and make sure he's fine.
Yes.
And send you home.
Yeah.
Lots of milk.
Oi.
I go down the wrong tube.
Oh, yeah. He doesn't really burp when there's breast milk, is it? When there's bottled milk, they burp. And they don't
No,
they?
they do. Yeah, you need to sit them. You need to get their back really straight. They burp easier then, don't they?
Yeah.
My mum said to me,
They're not usually as windy, I would say.
Yeah, some don't need it.
No, some do.
Trial and error.
Yeah,
my mum said to me like this.
yeah, and that's perfect. Absolutely. Some people just go,
Yeah, really.
and that's no good. Nice and
No, you're fine.
That's absolutely perfect.
The thing is, I have a friend in
I know. You need to be an octopus. There you go.
Ah, that was
You need
good.
to be an octopus to do that. You'll get used to it.
Thanks.
And it takes a while to establish successful breastfeeding. It
Wow.
isn't always like the videos.
No, I'm fine, but
Yeah. And then
years ago was
Yeah, the learning process.
exactly.
It was, you know, it was
in Gorge.
Yeah.
gorged,
And
and
also,
then once you get
it's different when you're at home. You'll be in a nice comfy chair with a cup of tea here, feet up, watching Neighbours or something ridiculous. But somehow we have got chairs that are very conducive to sensible breastfeeding. But you seem to be doing a jolly good job.
yes.
Which was, I don't know that book. It's either yellow.
We've cleaned them and we've sent to swap.
No, it's just the light. It's just the light.
The white city.
It's just the
That
light.
could be a little bit of jaundice.
No.
And honestly, it is so common, jaundice.
It is.
So common.
I looked it up on an NHS site.
Yeah.
It said it's
Yes,
common
that's
thing.
half the battle.
Lots of milk and maybe a little light.
Yeah.
Yes.
You might not though. Sometimes you look at babies and you think they're quite jaundiced, but then the
I
blood come back normal.
know.
Sometimes.
Yes.
Yeah, winter's really do the light thing. It's really quick, but I guess it's not effective.
No. We normally do a gas billy and then we send a formal billy as well, just to be on the safe side.
Sorry, what's that?
We do a bilirubin when we test.
Bilirubin.
We do it when we do a blood gas, looking at the oxygen in the baby's blood. And things.
That's when the red blood,
That's
the
it.
cells are breaking down. Isn't
Yeah, that's it's
They
usually
release
an immaturity of the liver
Yes.
that doesn't break
right.
down. But very, very, very common. I would say, what would you say, 95% of babies get 18
Breastfed
or
babies, yeah.
Yeah, about 3 days after.
Yes, yeah,
That's
yeah,
the day that that's usually the highest.
yeah.
Oh, we actually wrote it in your diary, Land, actually. We wrote it in your diary.
So what day, when was he born?
1st of February.
Oh, right, right.
Little man.
I was at a birth on the 1st of February as well.
Yeah.
And the baby was born at
Brilliant.
0102.
Oh yeah, sorry, I'll just be back in one moment.
Hello, man.
I'm sorry, I missed it. If we had a crystal ball, if we would have known, I could have come to see you a couple of days ago or something. There's a good be there.
Okay, so you don't remove my coat. Hello, man. Hello, man.
So earlier they said a doctor turned up at your house at some point. Which day was that?
Which doctor was just today?
Was that today?
What day? What time?
The doctor was just today.
It was yesterday because it's now on the next page. Yesterday. Yeah.
Brilliant. Turn up.
It wasn't legible. I couldn't hear it.
They have been confusing.
Want to listen to a message? Answer machine message. Can't understand.
No, you.
So she left a message saying that she was coming.
I don't know.
No. Slow down. Slow down. He answered the phone call and he said, the woman said that she wanted to come in to see the baby and that she was a nurse. And you told me that she was speaking in Portuguese. I went to the phone, I was next to him. I took the phone from him and I spoke and she was like, she was like in Portuguese saying, "Are you Yolanda?" And I said in English, "Yes, I am." And she said, "I want to come in." She said, I don't know now. She said, "You want me to speak in Portuguese or in English or something like that?" I don't know.
Are you Portuguese?
I am. And I said, "I speak English, thank you." And she said, "I want to come in, I'm a doctor." She said, "I want to come in," and I asked why. And she said, "I'm a doctor." The word, the terms was abrupt or
pushy, whatever we call it.
pushy. That's all I can say really. And the intercom just goes off. Really.
Time's up. Someone presses a button that calls, you answer
You
it,
get a few seconds.
you get, and then it turns off.
Is it okay if somebody comes in?
Yes.
Come in.
Hi there. Oh, thank you very much.
And
We need it.
and that's all we have from the doctor. That's all.
Look at little man. Thank you. Thank you. Thank you, little man.
Do you know if Lisa has come yet? The supervisor of midwives?
She was here earlier. Did she not come and speak to you? No, that's fine. I think she came when Dr. Sharma was in here, so I don't know if she wanted to go, but she was here. I'll see if she's still here.
Thank you. You want tea, sugar?
Yeah, but I will just say something to you first. That woman, we're speaking on the intercom. We're trying to speak as well, and the intercom just goes off. And she doesn't call again. And like I say, we don't go out to carry on the conversation. We are afraid. We are afraid. The
Do
way
you live on the ground
on the
floor?
ground floor, yes, with a balcony. Yeah.
Hello?
Hi, Lisa's here.
Sorry, I was here.
Siphoned
off.
Hi, Lisa.
Do you want tea? Do you want much sugar in it?
Yes,
Lisa. Hello. Congratulations and thank you. Thank you for coming in.
That's
I think
okay,
things
sorry.
are a bit calmer now and much better. Yeah. It was just, everything was a bit
Crunch point.
Yeah, and they asked the doula to go, so
Okay,
which upset Lillian somewhere else in the hospital. I think
She's still here, somewhere.
she doesn't have a way of leaving, so
Okay,
yeah,
she
she came in with the police.
guys. Okay.
I just wanted to say You know that I just want to say that the other doctor that they have been talking about it, that it's been completely confused, and the way it has been talked about is completely confused. The other doctor is that my partner called to the GP saying, can we have a doctor? Because this is doctor there for many years, can we have the doctor to come and check the baby, please?
That's all. Not.
And
baby's
we have been
unwell,
told
nothing.
no, because they asked the name and I said, we don't know yet. We haven't decided yet. We didn't have time yet. We have been not allowed to think of names yet. We didn't know if he didn't know if it was a boy or a girl. I knew it was a boy from my echo, but he didn't. So I didn't decide alone. I have been told by social service he had 9 months.
Yeah, that's it.
Yeah?
No.
So this doctor, he's my partner that today rang the GP asking for him to come.
Yeah, to check the baby
They
over.
said, we never spoke to him. We have never spoken to him. On the phone they said, we cannot do it because you don't have a name, so then we can.
Just do one of the little blood tests.
Can we do the blood test?
Is that all right?
We talked about, is that okay?
I've got it. There we go.
So
I'm packing
that's
those.
fine. So they said no because we can't register. We cannot register, so we can't. So he said, okay, so get an appointment for you then. And he gave the name, and this thing said in his name.
From his heel. From the wrist.
So it's the GP, he's the GP. That's a doctor, and the other doctor is the person that went to the house and knocked on the door, it seems. What they said, what they have been saying all the time is that he said that the baby was not well. Something that we have never said. We just said we want someone to turn up and see the baby. That's it. That's it. I don't know how I'm doing now.
Oh, I know. Oh, you haven't done anything yet. Oh. To protect his eyes, right.
So that we had the police.
It is.
Turn it down.
No,
After that.
he's chewing seats. He's going to protect it.
And I've asked if that can be shared with the parents.
So he's discussing it with the social workers at the minute. So I think the plan is that they're going to come and have a conversation with you guys as well about it. So that's the sort of latest I've heard. So I sort of tried in there first. But yeah, because obviously I've heard some of the conversations, obviously from this side, and so actually want to hear your side of the story as well. So and how it sort of all made you look shattered, you look absolutely worn out.
She's lost 2 liters of blood.
Yeah, exactly. Not had much sleep.
Or
And looks like you've been feeding the baby a lot. Yeah, worn out.
he had no sleep.
And you haven't slept either.
I've had a little bit.
A little bit
of sleep.
Yeah. Hard work, isn't it?
I'm going to live by his rhythm.
Have you slept there?
Have
you slept?
Have I slept? Not really. I don't really.
Right, mate.
Shall I just explain the test that I'm going to do, just so that you know? So, we're taking the swab of the eye, because it looks really gunky, so that's one test that we've done. This is going to give us an instant sort of look at hydration, so salts, sodiums, potassiums, blood sugar, and also a quick jaundice level, although it's not as good as going to the lab. And then these two, one will look at infection markers, and then this one will also look at jaundice level and a different type of infection marker just to rule out that there's no problems there, particularly with the eye. And this one is if we're worried about any of these, if any of these come back worrying about an infection, then we'll send this one, which is where they look at it in the lab under a microscope and check see if it's growing anything. But at the moment we've got no grounds to kind of send that yet, because clinically he's well, but he's got the jaundice and he's got evidence of infection in his eye. So we're worried a little bit, but not really worried. Does that make sense?
We would do this for any baby we were looking at.
I don't know. Yeah, it's looking more like pus at the moment. Oh, that goes into a gas analyzer machine. Okay. Now what I'm going to do, because it's quite a bit to take and it can be difficult to do it from the heel, it's quicker and easier and in theory less painless if I take it from a vein in the hand. So it's one needle in and then one out.
Suck on a finger like he was doing earlier, and that'll calm him down if you want to, Dad.
If Ginny just comes around and helps on this side, just because he needs to be held quite still.
What we're going to do is, once we've done these bloods, we're going to get baby moved into our intensive care room.
Intensive care?
Yeah.
So you said room 1 earlier on.
So,
Sorry, can I?
yeah.
So you've changed what you said.
I have.
Why? Can you explain why?
So at this particular, so at the moment, the way our rooms are spaced, we've already got 13 babies in our special care.
Okay.
Now we have to have a ratio of nurses who can look after babies. And at this particular point, I think it would be safer because we've got beds in this room to be able to take him into this room.
So where will Yolanda go?
So Yolanda at the moment will provide a room for just outside.
So very close?
So 24/7 access to the baby from your perspective. Can I just say that social services want to speak to you as well?
Yes,
Yeah.
we
so,
were.
yeah, social services want to speak to you as well. So from our perspective,
We're aware.
are you okay watching this? Do you?
He's a good boy. He's a good boy. Completely locked. He's a good
So
boy.
I'm just going to get a cup of tea, a cup of coffee. We've got some. We've got some tea.
This one's got sugar in. You want some tea?
I wish to have
toast?
this to pick that's why.
You want some tea or toast before it's cold?
Oh yeah.
No, I don't.
Oh,
My baby,
Good boy.
Look at star. Can I touch my baby's feet?
Yes, of course.
Mama's here. Mama is here. Mama's here, baby. Baby. Baby's here. Daddy's here. We love you. We love you. Daddy's here, babe. Babe, Daddy's here. Daddy's here. Daddy's here. Baby.
There's your voice.
Used to it.
Baby. Oh, baby. Baby. Mommy's here, baby. 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 Daddy's here.
Right.
Baby.
Quite chilled out there.
You're being very good. The doctor is crying. The doctor is crying. He's been very good, isn't he?
Yes.
Baby. electrolyzer.
Yeah.
How much blood are we going to take?
It's 0.75 of a mil.
All the tests. I lost 2 liters, and let's see how much my baby is going to be stolen. Yes, it's stolen. There is no consent in here. No consent. I have been abused.
Yolanda.
All done.
There we are.
Yeah, all done. Very good.
What a little star.
It was very good, wasn't it?
All
Very good. How long does that test take?
So
Oh, they go to
these
the
ones
lab.
go to the lab. They take about 4 to 6 hours roughly. We have got one that's going to be in like almost instant, so a couple of minutes, and that will give us a bit of an idea as to where his jaundice level is.
Okay, so now why is it going to be again?
Because then,
The staffing,
Staffing. We've got a bit short of staff tonight.
nurse staffing.
No,
they're-
stop.
We have got staff, but they're very busy down in room 1.
You guys know that you are lying.
Yolanda,
You know that that's not true.
Yolanda,
That's
come
an
on.
excuse. That's something that
Yolanda,
the things that have been changed.
Yolanda.
The things they are getting worse and worse and worse and worse
They
every
said 2 hours
time.
and now it's 4 and 6 hours.
Every time. I don't mean that you are lying, but you are. I mean that
Come
you
on.
have to explain what the doctor said somehow, because you are from here, so you have to
Yes, okay. Yolanda.
support what he said. That's all.
Come on. There, silver up. He's a good boy,
It's
isn't
not
he?
allowed.
Isn't he a good boy? He's a good boy, isn't he, babe? Isn't he a good boy? Isn't he, darling?
Yolanda, it would probably be really good to have some toast and some tea.
Yes.
I haven't eaten
I
all
know,
the
and your
time,
body's.
so now I'll be with my baby.
But you also need to make milk for your baby.
Oh,
So
Yes.
yeah.
Nana,
That's
have
the
some
most
you can-
important
you can
thing
do
for
both.
them.
Yes.
You can hold a foot and
No,
eat
I'll
toast at the
see.
same time.
Yolanda, have some tea.
Have a drink.
He can come back to you now.
Yeah.
He can come back
This
later.
is what we need.
Have a cuddle.
Okay.
Is it closed?
Yeah, pretty much.
There we go.
Giant plaster for his hand.
Closed.
Big.
There we go. You want to pop yourself down? I'll pass it to you.
You're gonna feed him, mate.
How about you having a little drink? Oh. There's your mum. There's your mummy. Which way round?
You're feeding him on that side.
Just here.
Yeah, I think so.
Yeah.
Be delighted. Don't worry about it. It's fine.
She's just.
There we go.
Hello, man. Hello, little man. Mwah. Mwah. Oh. Yeah. Yolanda? Yolanda? Look at your man. Look at your man. Yeah, he's going to start feeding now, isn't he? He's going to start feeding now. Look. He's feeding it. He does get. What's it, latch on quickly? Oh, he's looking around at us. He's looking around. No, they're going to watch over him. Yolanda, look. With the jaundice light. They're going to put the lot lights on him.
The jaundice level is 377. Okay. The cutoff for babies at this gestation is about 350. It's above that, so we're going to have to put baby on lights.
Under lights.
Yeah. Fine. Now,
Is that level 5?
so it's
Just
high.
above the.
It's high. I'm worried about it. I would be very worried about it. And my personal view at this particular point, just looking at those blood values from my perspective, is that we should do that soon. Yeah. If it continues to rise at 400, there's a risk to the baby's hearing.
Okay.
And he's not getting lights at the moment.
Okay. So they're going to put him under a blue light, Yolanda. Like a UV
Yeah,
light.
but kind of, you said that is something that is normal.
Sorry?
You said that is normal in the babies?
Not that level.
77 is very high.
The level's high, so they're going to put him
No,
under.
you said it's pretty common and
Jaundice is pretty common, but that level of jaundice needs treatment.
So they're going to put him under a light pack.
It's not invasive treatment. It's
No,
just
they're not going to.
lights.
They're taking the blood test.
Is it okay if we take the baby?
You can go with him.
you come with us.
You'll go with him, so you
Where are
take.
you going?
You take the baby.
there.
Can
Linda.
we finish his fee? Is that possible?
We can finish this feed. Yeah.
Only him knows what is going to happen if he's crying. You haven't been out, you haven't been out. You don't know. The things that have to change. Was one thing
Stop
and I was
this,
intensive
stop
care.
this.
Only him knows what is this
Listen,
about.
Stop.
I did explain to you.
He's crying.
Stop this.
No,
Yolanda.
I'm in charge tonight, and I've only got so many nurses. They are really, really busy down in room 1. We've had an admission, and it happens to be that this room here is the only one with spare cots.
We're going to room 3.
Yolanda.
Just because the twins.
Yolanda. Yolanda. Look at your. Don't.
What do you hear what he's saying, please?
So what we're going to do is we're going to move your little one into room 3, where we're going to put the baby in a cot and put him under blue lights. Okay? We've done bloods. I think if the salt levels come back elevated, I might even have to put him on some IV fluids. His sugar is okay, that's good, so that's a big positive. Okay? But his jaundice level is very high, and I worry about it. And if he were my baby, I would want to get him into lights. Okay?
That's all I want to hear.
Are you going with him?
That's all I want to hear.
You go with him. You go with him.
Come and see.
See when he gets settled.
You come and see where
Come
he
and
is.
see where he's going.
Come on.
Not those ones, they're a bit dry. Just make sure there's a bed ready.
Please stay by him. Feed him when he's feeding.
He's intensive care, but not intensive care.
No, it's just.
Honestly, I'm really, really busy. You have to squeeze me. You'd be really surprised.
People are talking.
We need bunk beds.
Yes, I do.
But that means I cannot go.
Yeah, you're coming with him.
Anytime.
Coming with him.
Anytime. Come on.
Coming with him.
Let's show you where he's going.
Let's show you.
Then it'll be less scary.
Yolanda, you're going with him.
You're coming with an out and you bed, and you can still come and go. Doesn't make any difference whatever room it is.
Yeah.
No,
No.
Just a movement, just a movement. Yeah, you coming too?
Is he ready?
You coming with him? Yolanda?
Do you have Lou's number? Can you confirm?
Got some tea.
You have Lou's number. Lou's. Speak with Lou's. And Lou's is the only one I can see.
Yolanda, I'm not laughing.
What did he say? What did he say on time speak?
Okay, so there's an order, 72-hour order.
Yeah.
The baby stays here for 72 hours. That's before. I'm not allowed to stay here.
Yeah.
That's it.
Yeah.
Okay.
72 hours. It's 3 days, isn't it?
Yeah.
2 days.
3 days.
Saturday, Sunday, and Monday. Okay? Carry on. Okay, carry on. Did they say anything with you?
No, there's nothing about me. But if you do take the baby away, you'll get arrested. Point is with them. Don't be conflicted. Just relax.
I don't have a lot of memory, so...
He's under a light. He's under a light. Okay? Hello? He's under a light.
Under a light.
It's me.
I didn't want to find the doctor. I don't know what you're in the street.
What don't you understand?
Don't worry about it. He's fine. He just needs to.
He's fine. And the, you know, the best thing, listen to me, the best thing about it is we're starting treatment now.
Yeah.
Yes, I never wanted my baby not to have treatment.
Yeah.
I want to be safe. You understand?
I do understand. I do understand you.
My point is we don't need my husband book all as well.
Yeah. All been a misunderstanding. But come on, we've got a nice room for you.
Let's go and check the room
Come
out.
and check the room out, and then you can see how close you are.
No. You need to speak with Lucy. She's the only one that can translate to my parents what's going on.